Receiving a kidney, what you need to know. Hi, are you considering a living donor kidney transplant? What are the medical, surgical, and psychosocial factors that you need to be aware of before you proceed? When someone is diagnosed with kidney failure, the treatment options are dialysis or a transplant. In dialysis, a machine filters salt, waste, and excess fluid from the body. This is usually done 3 times a week or daily, depending on the type of dialysis. For transplants, the kidney can come from a person who is deceased or from a living donor. However, the average wait for a deceased donor kidney transplant is 8 years or longer. Your condition may deteriorate over time and become unsuitable for transplant altogether. The most ideal is to receive a kidney from a living donor even before one needs dialysis. This is often the best treatment option. Imagine the house as our body. The person staying in a house built of straw is sheltered, but it has higher risks and the quality of life is not as good. The person living in a straw house wants a stronger house to ensure his safety. In this analogy, staying in the straw house represents life on dialysis. Staying in a brick house represents life after kidney transplant. There may be risks too, but they are less than staying in a straw house, and quality of life is much improved. With a kidney transplant from a living donor, one can live longer. There are other benefits from transplant. Due to better fluid and toxin removal, your health will improve. There will be less diet restrictions. You will be free to travel, go to work, and do so much more. Living donor kidney transplant can give you a second chance to get back to the life you had before. Now let's find out more about living donor kidney transplant. How is a kidney transplant performed? Well, it's about getting the functioning kidney of a healthy person into the body of someone suffering from end-stage kidney failure. Anyone who is healthy and cares about you can donate a kidney to you. During the surgery, the donor's kidney, artery, vein, and ureter are connected to you. The ureter are tubes that carry the urine from the kidney to the bladder. To strengthen the flow, a stent is inserted into the ureter. The stent will be removed 2 weeks later through a minor procedure. You will not need dialysis after a successful transplant. Like all surgeries, a kidney transplant also has some risks. The chances of developing a serious complication related to general anesthesia are less than 2%. There's also a 1% risk of surgical complications, such as internal bleeding, that may result in a second surgery. The risk of death is less than 1%. To prevent your body from rejecting the new healthy kidney, you will need to take anti-rejection drugs for life. You may experience a higher chance of infection, diabetes, cancer, and obesity from these drugs. Your transplant doctor will discuss these in detail with you. If your donor's blood type is compatible, you will be admitted 2 days before the surgery. You may be discharged 10 days later if you are well. What happens if your blood or tissue type is incompatible with your potential donors? Incompatible transplants can still be performed. However, you will need to be admitted 2 weeks before the surgery to remove the incompatible antibodies from your blood. This procedure is known as plasma exchange. The transplant can be performed once the antibody levels are low. You will need to stay for another 2 weeks after the surgery for monitoring. There are other alternatives. You can discuss these options with your transplant doctor. Paired exchange transplant, wait for kidney from deceased donor, or remain on dialysis. We hope that we have answered many of your queries on living donor kidney transplant. To proceed further, you and your potential donor will need to complete a health screening questionnaire. The information submitted will help us determine the next step most suitable for you. Should you have any further questions, we are here to help. Remember, You are watching this video because your doctor believes that a living donor kidney transplant is the best option for you. We hope that we have helped you understand and agree to.